Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our hospital system general director. Today is Incident Command Day 50, giving you the update from Albany Med on the coronavirus. We report in the 5 counties that there are now 2,080 people who have tested positive for COVID-19. That's an increase since the weekend, since Friday, but we know that they continue to do outpatient testing. Inside here in the medical center, we currently have 58 patients who are being treated for COVID-19. We have 38 on the floor, we have 20 in the ICU, and we have 8 on ventilators. So let's break down those numbers a little bit. Fred, the 20 in the ICU and the 8 on ventilators represents a decrease from our high water mark.
It absolutely does, Dennis. Our high water mark with ventilated patients was 36. And you'll recall several weeks ago now, we took a lot of transfers from New York City, a lot of sick patients, many of them vented or went on ventilators as soon as they got here. I think that decline down to 8 is tied to those people leaving the hospital.
So the numbers that we're seeing here represent, in many cases, more what's happening in this region.
Yes.
Since Friday, we've had 12 who were admitted, 3 that were discharged, and I think we've seen a couple admissions from nursing homes, and I think we're doing something specifically for that population.
We are. So the nursing homes in this community, and frankly across the state, have seen a lot of cases. And so what we're doing now is when a patient comes to us from a nursing home or other kinds of homes, group homes, we're considering them PUIs. So we're placing them on a special ward. We're testing them to see whether or not they're positive, and then if they're positive, putting them on a COVID unit, or if they're negative, moving them off that particular unit. So we're really trying to cohort them and not put them into the general population in the hospital.
And I'm wearing the shirt today for the patient triage managers, who are very skilled people who balance where everybody goes, often the difference between a medical patient or a surgical patient, adult or child. And it's often a very tight balance that they do when the hospital's very full, but they're also doing a particularly good job in this situation trying to find the right location for positive patients as well as what we call PUIs, patients under investigation.
Right. We want to be careful with those PUIs.
Let's talk a little bit more about some other numbers that we often highlight here. Let's begin with antibody testing. Last week we spoke about how the New York State had done about 3,000 antibody tests, pop-up locations throughout the state. They now today release newer results based on 7,500 people tested. And Fred, I think the numbers are still holding up about the same.
They are, which I think is very positive. That's a very, very important bit of news, Dennis, that the numbers are pretty much the same. Almost 15% statewide are positive for those antibodies. So it validates that first group of 3,000.
I did not see the results today that broke down downstate from upstate. We know last week the upstate numbers were lower than the downstate numbers. We'll see if they release those numbers later today. Another very positive number is convalescent plasma. Again, these are people in the past who tested positive for COVID-19, who've agreed to donate their plasma to treat patients right here at the medical center. That number now is
29.
29.
And soon the Red Cross should be starting their new process with the pooled plasma, which will really expedite and speed up the treatment of patients with convalescent plasma.
All right. Let's begin. Fred, do you have any questions for me today?
You know, Dennis, I do. So I sit in on the Iroquois calls. Iroquois is a hospital association in upstate New York, about 27 hospitals. And on Friday, they reported that those hospitals within that entity are furloughing about 5,600 healthcare workers.
Yeah.
So what do you think about that, Dennis?
We obviously have spoken about our strategy related to our workforce here, and we know that furloughing people is a very difficult decision. We ourselves have looked at the decisions that we have in front of us here. We're proud to report at this point, Fred, we haven't furloughed anybody yet.
No, we haven't.
We've chosen to take a different strategy. As you mentioned, we're taking our employees and we're sending them home on what we would call standby leave. We have now close to 300 of our employees on standby leave, which means that they are home. They are available to come back, I think you said, within 24 hours.
24 hours.
Full pay, full benefits, and we're going to rotate that workforce through. So I think at this point we're very proud of the fact that we have not furloughed anybody, and I think you're wearing a human resources jacket today, and they've been a big part of that.
They absolutely have. The standby policy and the strategic redeployment group, they've been front and center. Shout out to HR for all their hard work. I would add, Dennis, our workforce, to quote Fran, is our most valuable asset. they're very important to us.
They sure are. And speaking of Fran, she also spoke today, Fran Alpert, our Chief Operating Officer and our Chief Financial Officer. She has, I think, spearheaded an initiative where if we have our workforce who is home on standby leave, or perhaps some of the members of our workforce who are doing remote work, which is another group, we'd encourage them, if they can do so safely, and if they would like to volunteer in the community. The community has been incredibly responsive to us.
They really have.
They've created works of art. They've sent us letters. They've sent in food. They've been generous in many ways of philanthropy. And we would love to be able to say back to the community that has supported us, yes, we're supporting you here in the hospital, but we can also support you in the community. And I think we spoke today about different ways that people can volunteer in the community.
We did, and we're actually going to put together a list of groups out there that could use our help, and we're going to circulate that amongst the staff.
So if you're one of those members of our workforce and you would like to volunteer in the community, we encourage you to do so safely. Follow all the rules of social distancing and wearing the mask. If you can and you're out there and you can put on some Albany Med gear and send it to us at Albany Med Communications, or you can post it on your social media site, hashtag Albany Med Strong. We'd love to see you out there and recognize our workforce. Last week when we did this with the rainbows, I think we got such an outpouring. I'm sure we'll get the same thing again this week. So we'll maybe publish those at the end of this week back here on this video.
Terrific.
Okay, very good.
It's great.
So we're off to a start here on Monday. It's a busy week, and we have a lot of other things that we'll speak about as the week goes on. Once again, we ask that you please take care of yourself, take care of each other, and we'll see you tomorrow.